Yep.
Good afternoon. I'm Dr. Sandra Martell with the Winnebago County Health Department, and today I'm joined by Mayor Tom McNamara from the city of Rockford. So we have good news to report today. Yes, vaccine has been received in the region. Our 3 hospitals came and picked up their vaccine allotments and are beginning the process of vaccinating healthcare workers inside their walls. A couple of reminders, though, of general principles as we move through this. We're very excited. This is a great day and opportunity, but it's going to be a long process to get everyone vaccinated. Local health departments in our region are overseeing the allocations, and we all know that there are limited quantities available to start this vaccine effort. We also should be very clear that this is a very fragile vaccine, which is why it's appropriate to start it in the inpatient and hospital world. Why? Because it needs special temperatures. It has to be administered within a certain time frame. It has to be protected from light. So the initial prioritization are those healthcare providers on the front lines in the healthcare systems. The next priority group are residents of long-term care facilities. And you've been hearing about that through a contract with CVS and Walgreens, they will be going in and vaccinating the residents. But please be patient. I know we are all very excited. There's no waiting list or appointment list for other populations at this time. I know we are all receiving calls saying, please put me on the list, call me when it's available. We will announce when it's available, and we will go through the process of how you can get on any kind of a list. Please don't call your healthcare providers. They are also backed up with routine appointments, and calling them when they have not received a vaccine takes valuable time from their office staff and time. Please know that all adults who want a vaccine will have access in 2021. The vaccine is administered 21 days apart at this time, so people that are being vaccinated today or tomorrow or in the next 5 days are going to have to receive their second dose to be completely covered at the high rate of, protection, 21 days or 3 weeks apart. At this time, vaccination is voluntary, and it does require the consent of the individual. So during this time, we continue to need to practice non-pharmaceutical social mitigations. That includes masking, social distancing, frequent hand washing, staying home when you're sick, and limiting contacts outside of your household. Another good point today, and good news, is the number of cases. We are at 160 cases today. Our total case count to date is 21,238. But once again, this disease does not know an age limit. Children from 9 months of age to 96 years old are being reported. We also lost 2 additional residents of our community, and our heartfelt sympathy goes out to their families. The Winnebago County test positivity rate is 11.7%, and our regional positivity rate is 10.6%. I know we have all worked very, very hard to get here. The number of COVID positive and people under investigation in Rockford hospitals, as reported on Monday, was 145, which was down 3 since last Thursday. So once again, we're improving, but it's a very gradual and tenuous improvement. 98% of our individuals recover, and we are not reporting any new locations of concern. So as we look at some of this positive news, decrease in positivity rates, decrease in hospitalizations, no spike in cases associated with the Thanksgiving holiday. I want to thank my community. I think you did a great job over this. Decrease in number of new cases per week. Schools that remained in person did not report any episodes of in-school transmission, and they are finishing out the end of their school term week this week. So we want to thank those teachers, the school nurses, those superintendents, and the families in those schools who worked very hard to keep themselves in session through the end. And more entities are signing up to participate and provide the Binax Now antigen testing, which again, when you talk about test positivity rate, the number of tests is critically important, and it increases the capacity throughout our entire system. So what's the downside? We continue to have deaths, and our case rates continue above 50 per 100,000. So while we talk about coming into the next, maybe stepping back a little bit on the mitigations, we are working with the Illinois Department of Public Health and the Governor's Office to look at lifting some of our Tier 3 restrictions based on our improved metrics for our region in Winnebago County. So it's important that we understand that we are asking for that lift, but we're also going to have to hold vigilant because we have majority of our winter holidays are coming up when people want to gather, when they want to celebrate, when they'll tend to take their face coverings off to eat those cookies with each other. It's very important that we understand that those are the behaviors that we really need to work on as individuals and collectively as a community. So we continue to encourage the community to continue working on that, wearing a face covering, social distancing, frequent hand washing, staying home when you're ill, working home as much as possible when you can be remote, and continuing to support our local businesses that are suffering under these Tier 3 mitigations. Our hope is that we can continue this improved trend. With that, I'd like to have the mayor.
Thank you, Dr. Martell. Thank you and your team, especially now over the last couple of weeks, not just continuing to work to slow the spread, but also develop the vaccination plan and accept the vaccine today, which is really exciting. We're finally starting to see some really good news. We're seeing that lower positivity rate, and that vaccine is now here in our community, and implementation of it is beginning. However, as we've always said, as you're running the marathon, we still have a ways to go, and now is the time that we just need to continue to be vigilant. Even with this good news, we continue to see friends and family members tragically lose their life or contract this deadly disease. Now is not the time for us to lose our focus as a community. Just think of all the healthcare workers who remain on those front lines during this battle. And please remain focused and do it for them. In Rockford, we have right around 10,000 people who work in the healthcare systems and at clinics and independent practices in our community. We all know someone who works in the healthcare sector. So let's think about them and help them stay healthy and help them do their critical job that they're doing so well on behalf of all of us. So many sectors in our economy have struggled during this pandemic. I would argue that probably bars and restaurants have been hit some of the hardest in our community and across the entire state of Illinois. Today, I'm really excited that the city of Rockford is able to announce that 81 local businesses and clubs have received the City of Rockford Hospitality Grant. This award was based, as you're well aware, on changes in monthly revenue related to food and beverage sales when you compare 2019 to 2020 with this pandemic. So the $900,000 grant program that reallocates CARES Act funding to supplement state and federal relief programs, we had an average award of $11,000 with a maximum award of over $25,000 to these businesses. We know that these businesses need far more. We also understand that the health implications are intricately tied with the economics. So I would certainly ask everyone, continue to be vigilant, although you're hearing really good news, and it is really good news. So we should pause and celebrate that good news, socially distant celebration. But we also have to understand we got here through a lot of hard work. And no one, and I will be the first, or Dr. Martell would be the first, and maybe I would be the second, to say no one wants to have to go backwards. We've done this together. We need to continue to move in the right direction. That positivity rate is dropping in Winnebago County. It's dropping for our region. and now the vaccine is here. So let's work smart, let's work together, let's take care of one another, let's continue to practice social distancing, let's continue to not gather, especially during the difficult time of not gathering during holidays. Let's wear our face covering and wash our hands frequently. And to those employees who are able, please continue to work remotely. And at this time, we'll take any questions that you have.
I got a couple for Dr. Martell. Talking a little bit about businesses and some of the closure orders, what's kind of the threshold for when you guys consider taking away that food permit?
So the question is, when do we consider in the enforcement process to suspend the food permit? We suspended after the 7 consecutive 48-hour notices of closure, followed up by that letter of intent, indicating that we know that that facility or establishment has no intention of complying. We will then suspend their food permit.
So, I'm sorry, you said 7 consecutive orders of closure in...
Those are 48 hours, so that's 14 days.
So we see on some of your guys' websites some data talking about there is some right at 7, and then there's actually one business even in that order to close food permit hold category that only has 5. Is this not a direct process, or is there some leeway? How are you guys deciding on those?
No, it should be 7. It's probably an error on the website, and we'll check into that. But we typically, our process has been 7 consecutive 48 hours order to close, then a notice of a letter that's sent out saying you intend not to close, and then we suspend the food permit.
Dr. Martell, you mentioned the Tier 3 mitigations that you're trying to have lifted.
Mhm.
What strategies in there are you looking to have lifted, and when can we see that happen?
So the question is, what strategies are being considered? Well, one of the things we're looking at is all the different areas from our own contact tracing data and what we know, and what we've learned through this process. So one of the things that we're going to have to consider about right now is that we know indoor dining has been we still have some establishments that are struggling very hard. Is there a way that we can do this during the winter months in a safe manner? It's not going to be full open, crowds packed, bars, where we've got bands playing and contests. That is not what we're talking about. We're talking about those social type gatherings. We also know that looking at the household size of gatherings with individuals outside of your household continues to be the greatest risk. And really, how can we do that? And we think maybe sometimes some of our establishments would do a better job of being able to host that holiday family gathering where households could sit and be in the same room and be able to, really work with that family and that household. So that's one of the areas. We have concerns about some of the capacity limits. We know that that's a challenge when we look at some of our stores and whether it's the fire code versus minus the space for the product. But clearly we need to make sure that everyone understands what those limits and restrictions are and how can we safely be able to kind of use those services and come together and continue to open up a little bit more of those that were disproportionately impacted.
So when could we see any of those lifted? How does that process?
So the question is, when can we see that? We've heard from the governor that they are looking at all of their options, and there's a great deal of concern about the upcoming, I'm going to say, Christmas, New Year's holiday. It's hard to believe it's only a week away, right? So we've got 3 weeks. We worked very hard in this region, and I don't want to take that away from anyone. We did not see a spike in cases around the Thanksgiving, but we did see increased, we had cases. So again, trying to make sure people understand this is not the time to, as the children are home from their school breaks, as their college students return, as you want to see family and friends that maybe you thought, okay, I didn't do it for Thanksgiving, maybe I'll do it for this holiday. It's still going to be a challenge, and I think that there is concern that any spike could increase then, again, reduce our hospital capacity. And as we've seen, following hospitalizations, we have an increased number of deaths. And I think that we really have to be, we see the case rise, then the hospitalizations rise, then the deaths rise. And so that is not new to this pandemic. And if you look at our data, we posted our monthly report, you can see that this last surge was of a higher peak and a longer duration than our initial peak in the spring.
So something maybe in 2021 or early 2021 we could see those mitigations lifted?
We're hoping to have those conversations a little sooner than that to give people some reward and reinforcement for their good behavior. But again, we are looking at the science. We're looking at how we look at with the other regions. And again, working through all of those with state leadership.
You mentioned 21 days in between the first vaccine and then the booster. Do we have enough boosters to then revaccinate all those people who initially received the vaccine?
So the question is, do we have enough vaccine? So part of that allocation, why we can't just roll out, why not just go ahead and vaccinate everyone, is that there is a certain percentage of holdback at the state level to ensure that we're able to deliver that second dose, which is really not a booster, it's really a second dose to complete the series.
I got one more follow-up just on the business end. So you talked about the closure orders, 7 is kind of the threshold. Has there been any talk about closing all the businesses in non-compliance to kind of level the playing field for a period of time? Because we've heard that indoor dining is unsafe, and that's a loud message from you guys. Has there been any conversation about that, or why hasn't there, if there hasn't?
So the question is a generalized closure order for business. Well, again, within the authority of the health department, the last tool that we have is a suspension of the food permit for food, food establishments. Now, we go in and we cite, we've been out enforcement on the capacity limits on that. We can issue a closure, but again, the authority for that closure really is tied to other, I'm going to say other aspects of it. So we have issued, there's been orders to close of some sports camp kind of events. If you look on the website, you can see all of those in there, and I challenge everyone who goes into a store, make sure, are they counting you in? Is there someone there with the counter at the front as you enter? If they're not, I can probably tell you that they're not checking the capacity.
Dr. Martell, you talked a little bit about the vaccine shipments coming in, each healthcare system getting a portion. How involved has the health department been in that process, distributing them to the health systems directly?
So the question is, how involved has the health department been in distribution? So first of all, the health department oversees the allocation, so it comes to us. We work through our mass vaccination, or we call it a population vaccination plan, because we're not bringing anybody together on this one. And that has been posted on our website as well. And we got preliminary numbers based on their healthcare workers and their staff, and then we prorated the allocation that we received based on those numbers. And again, we worked with them throughout this to say, this is the number, can you do it in 5 days, right? So they had to not only do, and I want to really reach out to our healthcare workers who we probably, we talk about heroes working here, but they have had to kind of on a kind of moment's notice read up, learn what they need to know about this vaccine, and make a decision about taking it so that they can protect not only themselves but their patients. And so those systems worked very hard with very short notice to make sure that they would be able to use their allocation within that 5 day and not waste a dose.
And it's only going to healthcare workers and some inpatients in the hospital?
No, healthcare workers in the inpatient environment. And it could include environmental services, it could include food services, because again, those are all individuals that work in those critical infrastructures that are in those systems responsible for the care of patients.
You yourself, are you planning on taking the vaccine?
So the question is, do I intend to take the vaccine? And the answer is yes. When I am in the right phase and I am eligible in that phase to receive the vaccine, I will be taking the vaccine.
Same question for your McNamara as well.
So the question is, do I plan on receiving the vaccine? Absolutely. Absolutely. I think they've done a great job running it through the process, and I'll take it as soon as I'm within the phase to take it.
I got a couple for you on the loan side.
Yeah.
So you said this is going to reallocate some funds. Did you say that was PPP?
CARES Act funding.
CARES Act funding, right. Is that being distributed based on need? How does that break down? Is there a list that we can access?
Yeah, so the list should be posted today for you. I don't know if the list today will provide each and every dollar amount allocation per establishment, but we can get you that. But yeah, the list will be provided today to the public. We're also trying to notify those who are receiving it first. And it was based on how much revenue they lost from 2019 to 2020.
So Mayor, were there additional bars and restaurants who also sought grant money that you were able to fill out money for?
Yeah, the question is, were there additional bars and restaurants that we were unable to grant money to? So we had a total of 113 establishments request funding. We had 20 that did not meet the threshold of disrupted sales that was placed on us. We had 11 that had already received big grant dollars from the state, and we had 1 that we rejected. I will just add to that, there is a frustration I have. So a business that received a big grant was not eligible to receive the local grant that we're allocating. But a business that gets the local grant can now go and receive a big grant. These are state rules that really make absolutely no sense. So if you got the local grant first, then you can get the big grant. But if you took the big grant first, you can't take the local grant. It doesn't make any sense. We should be trying to do everything we can to get these dollars into the pockets and into the businesses that need it most, regardless of which order they got it.
Are businesses upset with that?
Yes. The question is, are businesses upset with that? That's probably the nicest way I've heard it put. I'm more than upset with it, so I can venture to say, since it's their livelihoods and their employees' livelihoods, they're more than upset with it. It really makes no sense.
And when you say big grants, these are grants from the state?
Yeah, the big grants are the business interruption grants distributed by the state of Illinois.
I've got a couple more follow-ups for you just about testing sites.
Okay.
Obviously, as the winter months come along, cold becomes a concern for people that are working outdoors. Some of these testing sites are drive up in that fashion. How are you guys planning to prepare for that, or the ones that are being aided by the health department? Is there discussions about that?
So the question is about the community-based testing sites. So those are operated by the state of Illinois with a contractor. And clearly when there's an issue that gets reported to us about what's going on there, then we escalate that up to the state. We understand that they are winterizing their sites appropriately and are making sure that they are staffed, but we do not have a direct connection with those particular locations. But we do appreciate when people report to us, and then we will escalate it appropriately. But I want to be clear that we cannot, find out immediately like why something didn't happen or someone didn't show up or.
Yeah.
Dr. Martel, I have a question about skepticism around the vaccine. I'm sure you've heard people are wary of some of the side effects. What would you say to someone who's hesitant to take the vaccine based on that?
So the question is about skepticism and the hesitancy about taking the vaccine. And I understand that it seems like this is, we call it warp speed plan to get to this vaccine. But I liken it to another time in our history when we rolled out, there was a mass vaccination campaign and a mass effort to produce a vaccine. And many of us are the beneficiaries of that effort, and that was the vaccine to rule out polio. When you think about there was a race across the world to develop a polio vaccine, many of our mothers and grandmothers collected money through the March of Dimes to fund that research, to get a vaccine developed. And we had 2 vaccines developed, and we are still using those 2 vaccines in the community at this time. In terms of this vaccine, it's new technology. It is very cool technology, and it's very safe technology. They've been using this kind of technology in the treatment of other kinds of illness and development of biologics. Now, obviously, my background is not pharmaceuticals, but again, to understand, and that these clinical trials were broad. They included many representatives from different groups, whether, gender, race, ethnicity, with the idea being that they needed a broad cross-section of individuals. So while this vaccine seems like it came up very quickly, there was a lot of behind-the-scenes work that went on to make sure that this vaccine, even under emergency use authorization, is not only safe but effective.
There is some talk about other possible vaccines getting FDA approval here on the horizon, even as early as the end of the week. How is that going to change the circumstances regarding the county when that does happen?
Sure, and the question is about the introduction of other vaccines. So we've heard about Pfizer and we've heard about the super cold chain. and how hard that is logistically, which is why the hospitals are where we're starting with this, because of that very sensitive, fragile kind of a vaccine. The Moderna product that uses the same kind of technology does not have as much of that sensitivity, so it's a little wider access and out and being able to distribute it out. And then there's others coming up behind that are not even as sensitive as that, but use different technology. So as more and more of these vaccines become available, we have more and more options about getting that out into the public. And that's why you see a very much, if you look, there's a phased approach. We know in this early phase 1A, there's a very small amount of vaccine available, right? So it's a limited supply. And as time goes on, we see more of that vaccine becoming, and then more and more population groups being added throughout that process to receive the vaccine. It's going to be a long tunnel to that light. If you hear the national estimates, summer, we are going to work diligently throughout this entire time frame. So we're still going to be contact tracing. We're still going to be doing case investigations. We're still going to have to be doing discussions and education around enforcement and mitigations, but we're also going to be working with our partners to vaccinate the population of Winnebago County. All right, positive day. Thank you.
Thank you. Are you going to be going through the whole thing?
Yeah, I know everything about it.
Are you